do this real quick. Do this, and then now, do you hear a sound? If you do it right, you probably hear a sound, but why do you hear a sound? Is Pac-Man actually in your ear when you scratch him? Not really. So what we have here is a sense of sound being caused by some movement. And this is what sound waves are. So you have the air molecules, and when you cause waves and differences if you cause waves in the air and due to the movement of something, this causes sound waves. And then what ends up is, and when you did that right now, you kind of cause these sound waves in your external acoustic meatus, and this traveled toward your tympanic membrane inside your ear. So what I'm getting at is that, again, all these waves that are caused, or these compression waves through something. It can be air, it can be through water. Like if you're taking a bath and then you lie back in the bath and submerge your ears in water, can you still hear things around? Might be distorted, but you still have your sense of hearing, right? So it's due to waves through something. This is what causes our sense of sound. So sound waves are kind of like the waves crashing on the beach, but instead of the waves being like these water waves, they're actually waves that are somehow causing pressure on your tympanic membrane inside your ear. But let's talk more about, okay, before we get on to that, so amplitude and frequency. If you have a music background, this may really help. But for this class, this is what amplitude is how tall or big these waves are. So what is, like, if you look at the waveform of a sound, how big, what's the difference in those waves? And frequency, so it's determining like what's the rate at which these waves actually arrive. So like if we're using our beach analogy, so amplitude would be how tall those waves are. Frequency would be how often these waves crash on the beach. And these both affect our sense of sound. Now amplitude, so I'm just showing you just a general wave, but what's happening here? Now you see the amplitude got bigger. So when you have an increase in the amplitude of the wave, that means that the sound is getting louder. But if you have a decrease in amplitude, that means it's getting softer. And if it got so soft that there's no line whatsoever, no amplitude, that would be pretty much total silence. Now frequency, here's our first wave again. What happens if you increase the frequency? Notice that these waves are now closer together, and when you have an increased frequency in a sound, that causes the sound not to get louder in pitch, but it actually gets louder in terms, and it actually gets higher in pitch. So the sound starts to increase in terms of its, how high pitched it is. But on the opposite side of the spectrum, if waves are less frequent, the sound will be lower pitched. So this is so again, amplitude affects loudness, frequency affects pitch. Alright, so again, amplitude, size of waves, increased amplitude louder, decreased is softer, and frequency, increased frequency, higher pitch, lower frequency, lower pitch. Now here's the anatomy of the ear. So you have three main regions. You have the external, middle, and internal ear. Now the external ear, so here we have auricles, and that's what our external ear, when you think about your ear in terms of just, if you ask someone to show you what their ear is, they'll point to their auricles, so that all the skin, cartilage, and flesh and adipose here. And then an external acoustic meatus, your ear hole, or your auditory passage. So what's the auricle function? The thing is that it's supposed to concentrate sound, and it amplifies sounds by 10 to 15 decibels, but it also helps to kind of like give you your sense of where a sound is coming from. So if someone somehow accidentally lost their ear due to some accident, they can still hear, but things like maybe they'll have a hard time determining where a sound is, and the sounds, or their perception of sound might be a little softer overall. Now the middle ear, so what musical instrument is this? This is a timpani, right? So this is the tympanic membrane, and sometimes called your eardrum. So it's kind of like a drum, because what happens, how do you cause the timpani to make sounds? Well, you somehow cause pressure on this by using the little mallets. That causes sounds. Why? Because you have the vibrations that causes all that movement of air. Again, due to those sound waves, due to the actual movement, this is what causes sound. Now, you have these things called auditory ossicles, and this tympanic membrane is linked to these So it's kind of like a daisy chain of all these little tiny bones in your ears. We didn't cover that in the skeletal part of this semester because I was saving it for this part. But yeah, these are parts of your skeleton. Just very tiny. But before we get that, well actually, we're running out of time. So, or actually we'll go over this real quick. So what's happening here? If you ever traveled in happier times when you could travel in planes without having to worry about getting sick, what would you might notice that, hey, you might have this kind of clicking noise, right? And what causes that clicking noise? And some people, for them, it's really painful. For me, it's kind of interesting. Like I can kind of do something where like I flex a few muscles and can cause an ear click myself and relieve the pressure. But it's due to this auditory or this Eustachian tube. Now, this is involving the tympanic membrane as well. The thing is that you always have this pressure on both sides. You have air pressure from the outside, and you also have pressure inside your skull as well, and through this auditory or this Eustachian tube. Now, the thing is that when you're flying up, what happens to the overall pressure in the plane? It kind of drops a little. So the thing is that if you have the pressure here and the pressure here, but all of a sudden this drop in cabin air pressure prevents this from being pushed this way, well, it's also going to cause this to kind of push this way as well. So it's due to the movement of the tympanic membrane and also the pressure inside the Eustachian tube as well. So this is why when they say if you're prone to the pain or you're annoyed by that click whenever you take off due to your ears so-called popping. So when they say your ears pop, that's all due to that changes in pressure between your Eustachian tube and the external environment. Yeah, so if you never had it happen before, then I guess you're fortunate, because like, I mean, I know some people, they say that it really bothers them, and or this is what maybe another reason why babies cry, or I think little children also have problems with that. That's why they have all these little gadgets for little kids to kind of help relieve the pressure. But another thing you can do is like yawn, because why? If you kind of make the pressure inside your oropharynx or inside your oral cavity, inside your skull, about equal to the cabin air pressure, that helps. Or you can chew gum as well. Yeah, someone does chewing gum. Yeah, so this is why it helps to yawning and swallowing release pressure. If you can make the pressure inside your mouth and inside your Eustachian tube and inside your middle ear equal to the drop-in cabin air pressure, if you kind of equilibrate it, then that prevents that kind of clicking. Yeah, so that's why it helps to relieve that pressure. But another thing why little kids might complain or due to not flying is that they're often prone to what we call otitis or ear infection. So common children due to some sort of infection, but what happens is it causes similar pressure and pain. But instead of due to like flying and air pressure, it's due to this infection causing swelling and fluid to accumulate. That pressure is painful to the children, so this is why they not only might be crying because of the discomfort, but because of all the things that affect the middle ear and the tympanic membrane, it's also kind of affecting their ability to hear as well. Alright, so now enough about the tympanic membrane. Let's talk about the auditory ossicles. So the auditory ossicles, you have three on each side of inside of each middle ear on either side. So you have the malleus, incus, and stapes. And notice that the malleus is directly connected to the tympanic membrane. So malleus sounds like mallet, right? And that actually comes from that is where it comes from. So malleus is the Latin term for mallet, and that's a hammer. Now what we have here is a hammer and an anvil. And incus is an anvil, so you can think of like when you're hammering out an ingot of iron or gold or whatever, too much Minecraft. Anyway, so then you have the hammer hitting the anvil, so that's what we have here. The malleus is hitting the incus, and then stapes is actually referring to a stirrup. So this is what we have with this arch right here. Now the stapes is actually more than just an arch, it's actually linked to this little round circular thing. So I like to think of like the stapes, like here's the stirrup part, but here's a hamburger press. But why do they use a hamburger press? Because it kind of has a round shape. So the stapes is actually linked to something called the oval window. Like this part of the stapes is round, and this oval window, this is actually what links to the bridge between the middle ear and the inner ear. So what happens is like tympanic membrane vibrates, that vibrates the malleus hits the incus vibrates the stapes By vibrating the stapes, you vibrate this oval window, and that causes pressure changes inside the inner ear. Now we're finally getting to the inner ear. I know we're running out of time. Oh my god. Okay. Alright, so two main parts. So before we get to hearing, let's talk about the balance part. So here we have so there are two main parts, or well, I guess you could say three main parts. So the part that's involved in sensory hearing involves this thing called the cochlea. But the thing involving your sense of balance and equilibrioception are the vestibule and the semicircular canals. And then you have the vestibular cochlear nerve, so then you have a cochlear branch going to the cochlea, and the vestibular branch going to the vestibule and the semicircular canals.